Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. President of the Nigerian Medical Association, NMA, affirms safety of the vaccine as he gets his first shot. Edo State government relaxes curfew, directs workers to resume fully as it records positive results against pandemic. Kenya imposes lockdowns in several cities as it enters third COVID-19 wave. We begin in Nigeria, which has recorded 5 COVID-19 deaths in the past 24 hours. This comes after a record of no death in almost a week. According to latest figures by the Nigeria Center for Disease Control, NCDC, last night, the 5 new deaths raises total fatalities in the country to 2,036. According to the health agency, 97 new cases were recorded in 14 states and the Federal Capital Territory. They include Lagos, which recorded 50 cases, Kaduna 12, the FCT 10, Bayelsa 8, Imo 3, Kwara 3 as well, Bauchi 2, Osun State 2. Several of the other states, Plateau, Zamfara, each have 1 case. Also, 1,015 community recoveries were recorded in the FCT, and this is data recorded over the past 2 days, and 10 community recoveries in Akwa Ibom State. Based on the latest reports, countries with the newest deaths around the world are Brazil, followed by the United States and Mexico. Globally, over 2.7 million deaths have been registered. In the meantime, as countries and regions race to vaccinate against the coronavirus, so far Africa has administered 7.7 million vaccine doses. The World Health Organization, WHO, has called for fairness in access to COVID-19 vaccines so as to improve vaccination in Africa. The WHO says that while vaccines have been delivered through the global partnership COVAX, current global supply constraints could mean a critical proportion of people remain unvaccinated for months. The global health body adds that vaccine doses have not yet arrived in about 10 African countries. Meanwhile, as controversies over the effectiveness of the AstraZeneca vaccine continues, the president of the Nigerian Medical Association, Professor Ujjay, is urging those yet to take the jab to approach health workers and take the vaccine, assuring them that it is safe. He gave the assurance shortly after taking a jab of the vaccine himself at the National Hospital Abuja under the supervision of the Chief Medical Director of the hospital, Dr. Jaf Momo.
Relax. Yes.
The vaccine is just quite normal. And I want to thank the CMD and his staff because the reception is excellent. If we have this all over the country, everybody will rush to the hospital. I'm very comfortable here. And the process is seamless. Documentation is very good. And I didn't even feel any pain when I was given the injection. By and large, I urge Nigerians to avail themselves. It's because I don't want to die yet of coronavirus. And I decided that I must come and protect myself. Drug is not without its own effects. So it shouldn't be seen as anything. If you have a slight headache, you take Panadol. If you have pain, Panadol will solve it.
Over in Edo State, the government has relaxed the curfew in the state, which is to now commence from 12 midnight to 5 a.m. against the old time of 10 p.m. to 5 a.m. In the same vein, civil servants are now to return to normal working hours. According to the state government, all measures put in place have yielded positive results, with case positivity rate dropping from 23.1% to 1% and active cases currently at 37. The chairman of the state's COVID-19 task force and deputy governor of Edo State, Mr. Philip Shaibu, who announced this at the government house Benin City, the state capital, however, urges residents to avail themselves the ongoing COVID-19 vaccination against the pandemic.
The case positivity rate has drastically dropped from over 23.1% to 1%. Fatality rate has been relatively stable. Active cases have continued to reduce, and now stand at 37, as our hospital and isolation centers are almost empty. We are witnessing a steady rise in COVID-19 recoveries, and the government has intensified the rollout of vaccination of eligible members of the public against the deadly virus. With over 16,328 persons vaccinated in the first 8 days of the vaccine rollout in Edo State, with improved COVID-19 indices in the state, curfew imposed is now revealed to span from 12 midnight to 5 a.m. as against the former 10 p.m. to 5 a.m. All civil servants are now to resume their regular working hours, but with strict observance and compliance to all COVID-19 protocols, including social distancing, compulsory use of face masks, and regular hand wash, among others.
Meanwhile, vaccination has commenced in Cross River State, with frontline health workers across the 18 local government areas getting their jabs. The State Commissioner for Health, Dr. Edo, made the appeal while flagging off the local government area-based vaccination exercise at the Federal Neuropsychiatric Hospital, Calabar, the Cross River State capital.
How about you, a celebrity?
The battle against coronavirus cannot be impactful or complete without taking advantage of the vaccination window. From state to state, the government continues to build confidence on the safety of the AstraZeneca vaccine while encouraging all to get vaccinated. In Cross River State, the government is giving priority to the frontline health workers to get the jab. This is because on a daily basis, they are the ones responsible for treatment of patients across the 18 local government areas of the state. The exercise is taking place at the Federal Neuropsychiatric Hospital in Calabar, the Cross River State capital, and the Commissioner for Health appeals to everyone to endeavor to take the vaccine, insisting that the AstraZeneca vaccine is very safe.
Even if you test positive and you have been treated and you have been discharged, you are still expected to take the vaccines as long as you do not have an active COVID treatment going on. You have been treated, tested negative and discharged. You are also encouraged to take it. It will help build your immunity to prevent you from coming down with COVID-19 virus a second time.
Not minding the present challenges of insufficient vaccines, the Chief Medical Director of the Federal Neuropsychiatric Hospital insists the vaccination process in the state will be a successful exercise.
If we can get back to normalcy, the vaccines are a key step to getting this, the rhythm back. So this is my card. I've been vaccinated. And I urge every one of you, it's free. I've taken it for the last 40 minutes. I have not tipped over. So please go get vaccinated.
Cross River State was one of the states that accepted the existence of the COVID-19 virus quite late. But today, they are living with the reality of the virus and are now working pretty hard to combat the spread of COVID-19.
For more on the vaccinations in Cross River State, Dr. Janet Ekpeyong, DG, Cross River State National Primary Healthcare Development Agency, joins us on the program via Zoom. Thank you for joining us.
Thank you very much for having me.
Tell us, how is vaccination progressing across the state? Are there any challenges with the rollout?
Oh, yeah, okay. Cross River State rolled out its vaccination on the 19th of this month. And initially when we started, there was a lot of hesitancy from even health workers. But I'm glad that as the days progressed, the demand for the vaccine has actually increased. Currently, about 20,000 Cross Riverians have been vaccinated so far. And we are very pleased with the number and the high demand for vaccination. So we are very happy with the numbers so far.
In terms of the hesitancy you mentioned, because we know that in terms of the faces, you have frontline health workers. So based on the number you've talked about, I want to believe that those are frontline workers and maybe the politicians. Are there security involved? And this is before the larger cross-river variants. And I'm asking this because there's still quite a number of people who are really hesitant to take in the virus. So is there public education, enlightenment that's going on while you, of course, roll out the vaccination in the phases as it's meant to go?
Oh, yes. So in the course of this exercise, we've actually had to engage with a lot of people, including health workers, because honestly, health workers as well, they were all hesitant, in taking the vaccine. But with continuous engagement, continuous sensitization, education, and constantly engaging them, I think we've been able to do at least convince a lot of them to actually take the vaccine. And since the first person who took the vaccine is still very much alive, that has actually given a boost also to our people accepting to take the vaccine. So health workers were also a problem, other frontliners as well. The police, the Navy, and several other force, military and paramilitary organization, even including teachers. So there was that hesitancy initially, but I'm glad that so far there's been acceptance, and the numbers keep increasing every day. I think the major challenge we have currently is because of the e-registration, which is not only peculiar to Cross River State, because a lot of states are actually experiencing this as well, because of our terrain and all that. But so far, I'm actually very impressed, and of course, we are not relenting on constant engagement, providing all the necessary information, education, and communication to ensure that everyone who is meant to have this vaccine in this first phase is actually get vaccinated. So we want to ensure we cover all frontline workers in Cross River State, and I'm glad with the progress we've made so far.
Dr. Ekpeyong, you just mentioned about 20,000, over 20,000, but just getting an update, and this is from the National Primary Healthcare Development Agency, and it says for Cross River that the state has only vaccinated about 1,840 people, which is about 3.4% of the target. So how do you reconcile all of that data?
Okay, so that's the major challenge that most of the states are actually facing right now, because you need to do e-registration and, of course, verification as well. And because of how Cross River State is, we have very difficult terrain where there's no network, and you must make sure that as you capture these people in those communities, you have to travel all the way to where you can actually get network to see how you can upload all the information to the dashboard or to the database. So that has been a huge challenge most of the states in Nigeria are currently having, and I'm hoping that the federal government can help also help us in that aspect to see how they can reconcile this as well nationally, and ensure that all the bottlenecks and make sure it's not so cumbersome, because a lot of people have had to travel all the way just to see how they can get information to database. But we'll continue to try, because currently what we have on ground is that about 20,000 people have been vaccinated. But in terms of capturing them electronically, that's where the challenge is, and we're working to see how we can reconcile the data we have of those vaccinated with that captured on the dashboard.
All right, a very important strategy. We'd like to thank you, wish you all the best in your efforts. Thank you so much, Dr. Janet Ekpeyong, DG Cross River State National Primary Healthcare Development Agency. Thank you for joining us on the program.
Thank you very much for having me.
Now, the COVID-19 pandemic has reversed development gains for millions in poor countries, creating an even more sharply unequal world. That's according to a new UN report that was released Thursday. According to the Financing for Sustainable Development Report 2021, the global economy has experienced the worst recession in 90 years, with the most vulnerable segments of societies disproportionately affected.
The message of the report is clear and it's stark. COVID-19 is the leading sharply bifurcated world, leaving hundreds of millions of people behind and putting the development agenda seriously at risk without immediate action on financing for development. The pandemic has caused the worst recession in 90 years and disproportionately affected the most vulnerable segments of our societies, including women and youth. We're seeing between 119 and 124 million people estimated to be the newly pushed into extreme poverty, and the world has lost the equivalent of 255 million full-time jobs. Today's new report puts forward important recommendations. It calls on governments to invest in people, social protection, sustainable infrastructure, and green jobs. It also calls on the international community to support the poorest and most vulnerable countries with debt relief and other measures to ensure liquidity, including the allocation of additional special drawing rights. The United Nations is strongly committed to helping ensure that all our countries can emerge on equal footing from this crisis and with an equal chance of building a safer, healthier, more equal and sustainable future.
Still ahead on the program, it's a third wave for some countries across the world. We'll tell you those countries and other stories when we return. German health officials are warning that the current increase in coronavirus cases is likely going to be harder to curb than the previous two, in large parts because of the more virulent and more easily transmitted B.1.1.7 variant. This is coming as EU leaders have been meeting to discuss the sluggish vaccine rollout. Deutsche Welle correspondent Rob Warts joins us now from Berlin. Thank you, Rob. How bad is the vaccine rollout perceived to be?
Confidence in the EU's vaccine rollout is at a real low point. The bloc ordered more than enough doses to be able to keep up with countries like the United States and the United Kingdom in terms of the number of vaccines it was administering, but it simply hasn't been able to do that. You can tell when you just look at the figures. I mean, in the United Kingdom, 45 doses have been administered for every 100 people there, whereas within the EU, less than 13 doses has been issued for every 100 people within the bloc. And the rollout has been dogged by problems from the very start. I mean, they were late to approve vaccines here in Europe, and when they did, they were immediately hit by shortages. There's also a great deal of anger among member states and among EU citizens about the amount of vaccines that are being exported from the bloc. It's exported more than 70 million vaccines to various parts of the world and hasn't imported a single dose.
So is there now a plan to improve things?
Well, we had this virtual meeting of EU leaders chaired by the head of the European Council, Charles Michel. Afterwards, he said that there was a resolution to improve production of vaccines around Europe and also to improve the distribution of those to member states. Those are two things that do need to happen if the vaccination situation here is going to improve. Now, Emmanuel Macron said that this meeting should mark the end of naivety on the part of the EU. It's felt that it has been outfoxed to some extent by other countries who have been receiving vaccines but not sending any back. The UK is really the main target of that criticism. The UK has received some 9 million doses from the EU. And also, the EU is suffering these shortages of vaccines like the AstraZeneca vaccine that it's producing and sending to the UK. So EU leaders have agreed in principle to start blocking exports of vaccine doses to countries like the UK and to the US, which has received a million vaccines from the EU. In fact, Joe Biden took part of this call. Now, whether or not they will actually enact those export bans remains to be seen.
Finally, Rob, Germany was once seen as a world leader in handling the pandemic. What's the situation there now?
Germany is really struggling to get back on top of the pandemic here. It's become clear that here and in other EU member states like France, Belgium and the Netherlands that a third wave of COVID-19 cases has arrived, driven by more dangerous variants that have arrived from other countries. And confidence among Germans is falling in their government's ability to handle the pandemic, despite at one point being very high indeed. That was made much worse this week when on Monday, after a meeting with the heads of the 16 German states, Angela Merkel announced a tightening of restrictions over Easter, which is coming up next week. Then, only 2 days later, to backtrack on that and cancel that tightening of restrictions. The Chancellor issuing an apology to Germans, saying that that original policy had been a mistake.
Thanks, Rob Watts there, Deutsche Welle correspondent. Thank you for that update. Now, France has accused the UK of blackmail over its handling of coronavirus vaccine exports amid continuing tensions over supply chains. Foreign Minister Jean-Yves Le Drian was asked whether the EU had been scammed by sending millions of doses to the UK while its own rollout stuttered. France has called for the EU to implement tougher export controls. Here's more on the global COVID-19 update.
Germany will require everyone entering the country by plane to undergo a coronavirus test starting on Monday night. Previously, only travelers from high-risk areas were required to present a negative test. The measure comes as health officials say there are clear signs that the current wave of coronavirus infections in Germany could be worse than the first two. Over in France, officials say hospitals in Paris are under heavy strain and are already pushing the limits to welcome more patients. The number of COVID-19 patients in intensive care is now close to the mid-November high of 4,919, though still well below more than 7,000 people in ICU during France's first coronavirus lockdown in the spring of 2020. 19 French regions are under tightened COVID-19 restrictions, including Paris region. Kenya's President Uhuru Kenyatta has banned all inland travel in and out of 5 counties, including the capital in Nairobi, to stop a surge of COVID-19 cases. No road, rail or air transport will be allowed until further notice. Kenya's COVID-19 positivity rate has jumped from 2% to 22% between January and March. The president says at least 7 people are dying every day from COVID-19. In Nairobi, 6 out of 10 people test positive for COVID-19. Argentina will suspend flights from Brazil, Chile and Mexico starting Saturday to prevent the spread of different strains of the coronavirus from entering the country. Travelers returning from abroad will also be tested for COVID-19 before boarding the flight, upon arrival and 7 days later. A similar measure is already in place for flights from the United Kingdom. And finally, Brazil's Butantan Biomedical Institute is seeking approval to begin human trials for potential COVID-19 vaccine, making it the first shot developed in the country to reach clinical testing. Sao Paulo governor says the goal is to begin inoculations with the vaccine in July.
Don't forget to protect yourself. Continue to take responsibility. Visit our website for more updates, a better understanding of the pandemic. You can find the latest stories there, plus other stories as well. Politics, business, sports, all at your fingertips. It's channelstv.com. That's the program this evening. Thank you for watching. Stay healthy. I'm Millicent Walker.